Okay, so moving on to some risk factors for axial spondyloarthritis. So it tends to affect, the people who present with this disease tend to be of age less than 45 years old, so relatively young. They may have a family history, like a first-degree relative parent, sibling, or child who has either ankylosing spondylitis or axial spondyloarthritis, or some other disease that is within the family of spondyloarthritis, such as psoriasis or inflammatory bowel disease. They may have the presence of this HLA-B27. And ankylosing spondylitis, there tends to be a predominance of involvement of men, higher frequency compared to women. Whereas for non-radiographic axial spondyloarthritis, there seems to be a more similar occurrence between men and women. And smoking is also a risk factor for axial spondyloarthritis. So some symptoms of axial SPA include persistent lower back pain, gradual onset of in a person who is less than 45 years old, persistent chronic pain lasting more than 3 months. And this pain is very peculiar in the sense that it may be worse after rest and inactivity and worse in the mornings, which is what we coin as inflammatory pain. That is quite different from mechanical pain, which may be due to overuse and mechanical stress or degenerative pain. It also tends to improve with activity, may wake a person up in the second half of the night or early morning due to the pain. There may also be a symptom of morning stiffness, typically lasting more than 30 minutes, and may also be associated with buttock pain that may alternate between the left and right sides, and this may reflect involvement of the sacroiliac joints. So doctors may suspect axial SPA in people who develop back pain before the age of 40 to 45. And when this pain and stiffness gradually develop and persist for at least 3 months, when pain and stiffness tend to ease with physical activity and exercise, when rest doesn't provide relief from back pain and stiffness, and when the pain and discomfort increase when sleeping or resting, improving when up and moving. So in advanced ankylosing spondylitis, a person may go on to develop a stooped hunch posture with a limited spinal mobility. So enthesitis, which I explained earlier, which is inflammation at the site where the tendon or ligament joins to the bone, can be seen in axial SPA. It is usually either occurring within the joint, but can also occur at sites that are distant from the joint, such as these 2 areas in the Achilles tendon and the plantar fascia. So this may present as a heel pain. There could also be pain in other joints, such as the shoulders, hips, knees, ankles, feet. The upper arms, such as the hands and elbows, may be also involved, but tend to be less common in patients with axial spondyloarthritis. Sausage digit, which is pain and swelling of the entire finger or toe in this picture, can also be seen in patients with axial SPA, although more commonly seen in patients with psoriasis. And other symptoms may also include fatigue and lethargy. So other associated conditions of axial SPA include eye inflammation, also known as uveitis. In this case, a person would need to be reviewed by the eye doctor, an ophthalmologist. There are some that also may also have bowel inflammation, known as inflammatory bowel disease. And there are 2 types of inflammatory bowel disease. One is ulcerative colitis and the other is Crohn's disease. Another associated condition is psoriasis, which is a skin condition.